governor's tweet yesterday sent superintendents into a tizzy because districts without air conditioning are interpreting it that they can relax mask restrictions indoors immediately. Districts with air conditioning are talking to their board attorneys and their local departments of health, who are saying that if you have air conditioning, it doesn't meet the standard of extreme heat. So you have this confusion today amongst districts, and some districts saying masks are completely optional, indoors, outdoors. Some saying that it's outdoors, it's completely relaxed, but indoors we have to keep it because we have air conditioning, and we're waiting to hear from the Department of Health. But that information went out yesterday without any clarification from the Department of Education or the Department of Health. So there's a lot of confusion around this issue, and parents are now, the whole point of my letter was that school district leaders are the lightning rod for a lot of parent anger, upsetment, and confusion. They're now more confused today than they were 2 weeks ago.
Right, because I think what's important for, the people at home, and there seems to be this confusion, state to state, that we're really seeing. But the New Jersey governor said in the case of extreme weather that it's really up to the superintendents to relax the mask mandate. So, Dr. McBride, I'm going to bring you into this conversation as we take a look at New York, New Jersey, Connecticut, and, superintendents, teachers, parents, everybody feeling a lot of frustration about the lack of maybe clear guidance on this.
Right. I think it's such an anxiety-filled moment in time. There's nothing more precious than the health of our children. I'm a mother of three, and their safety and well-being are paramount. And I really feel for kids and parents who are struggling to, get clarity on what's the right thing to do. Here's the thing. We really just need to look at the data to figure out what, makes sense for most kids in this country. Masks outside really don't need to be mandated. There's no evidence there's no reliable evidence, at least, to show that outdoor transmission occurs in enough of an amount to warrant outdoor mask mandates. What would be really, really nice is if CDC would issue clear metrics and guidance on school reopening, like the UK has done. It would be really great if CDC could say, look, we understand there are high-risk children. We understand there are schools that can't meet, ventilation requirements. But for most kids, when school is essential for their health, safety, well-being, and learning, let's try to think about clean metrics like the UK had, where they took away restrictions from children unless they wanted to continue to mask for individual reasons, when the hospitalization rates were under 5 per 100,000 population. Right now in New York, for example, it's 0.51 per 100,000 population. That's the rolling average for 7 days. So we're already there in New York. I say we, I'm in DC, and DC is about to hit this exciting landmark. President Biden said, he wants to have 70% of adults over 18 to have at least one shot. And DC is about to get there. New York and New Jersey and New England is doing phenomenally in terms of getting more vaccines in arms. But I guess the point is that we need clear guidance from CDC, and we're in good shape right now in many places, and should be in much better shape by August to have kids unrestricted, unless they of course need to be restricted because of particular unique health conditions.
Now, for Dr. Zywicki, how are you able to ask your staff if they're vaccinated, or how does that work, and how do you figure that out?
So we did do a survey, and also staff members are voluntarily reporting. We estimate that we're above 75% of our staff members are fully vaccinated.
Okay.